Welcome you all here to Community Medical Center. My name is Robert Stegmeyer, and I'm the CMC's President and CEO. And with me today is Dr. Glenn Steele, President and Chief Executive Officer of Geisinger Health System. And we're here to make a major announcement and share the good news regarding the ongoing provision of quality medical care in this community. As healthcare continues to evolve across the country and hospitals partner with other organizations, there has been considerable speculation locally about the direction of CMC and which direction we would take to be best positioned for the future of healthcare in this region. Well, we're going to end that speculation here and now. I'm pleased to announce that the Board of Directors of both the Community Medical Center and Geisinger Health System have unanimously approved moving forward such that CMC can join the Geisinger Health System and be fully integrated into Geisinger. Pending regulatory approval, we anticipate that will take about 6 months. We will move forward and merge into Geisinger. Geisinger was is nationally recognized model for healthcare quality and value, and we're very, very pleased to be joining this prestigious organization. It's important for CMC as we move forward to join a growing, successful healthcare system, and equally important for Geisinger, I believe, to partner with another quality not-for-profit healthcare corporation with similar missions, values, and standards of care. Further, Geisinger brings innovative solutions and the stability that will enable investment in our employees, technology, physical plant, as well as extensive experience in patient care, education, research, and service. CMC will continue to be an open staff hospital with both employed and independent community physicians. Further, we expect there will be no change to our employee status as a result of the merger. And Geisinger Health System Board of Directors will be expanded by 2 seats for CMC representation. And I'm very pleased that our board chair, Mr. Jeff Jacobson, on my right, and Ms. Virginia McGregor on my right as well, will be joining the Geisinger board. And I personally want to thank both of you for your leadership and wisdom and how you've helped me in this process. And I think Geisinger is being 2 great assets in this transition. And now I'd like to let Dr. Steele say a few words.
Thanks very much, Bob. We're really honored to be merging with the high quality, high value institution in Scranton. It's interesting, as I mentioned to the folks that we talked to earlier today, that your history, your founding was a number of far-sighted women. Our founding in Danville was one far-sighted woman, Abigail Geisinger. I think what that means is we probably ought to listen to the women in our lives. We feel extraordinarily privileged to be moving into Scranton. We think that the values are very, very important. We think that the commitment to the community is something that working together we can build on in a way that could not be done working alone. There are a couple of people I'd like to thank personally. Jeff and I have been through a number of months of intense conversation, and Virginia has been extraordinarily helpful. And I think that I've been impressed that your board at CMC has really asked a single question, that is, what could be of most benefit to the community that they're fiduciarily obligated to serve. And then Bob, I don't think we could have done this as well, and I expect that we won't transact it as well without really good local leadership. And Bob's done a magnificent job over a short period of time. So our plan is for Bob to actually transact the deal that he negotiated. That's always an affirming aspect. And a couple of important points for you all, and then we can open it up for questions. We've committed to $158.6 million over the next 7 years. And our commitment is a commitment not only to rebuild the hospital base, which of course will be at the center of our system, but it's a commitment to build the community practice, the doctor specialty programs here in order to actually provide a continuum of care. We would like to, working together, we would like to take care of people with chronic disease so they don't necessarily have to be admitted to the hospital for tune-ups every 3 months. On the other hand, when people need to come into a hospital, we want to have all the specialty and subspecialty programs with great credibility and great expertise so that no one has to leave Scranton to go to Philadelphia or New York City or to Danville, for that matter, or to Danville. We think that the combination of our national reputation and your regional reputation is absolutely unbeatable. We've been able to recruit throughout our system extraordinarily well over the last couple of years, 120 net doc recruitments last year, 140 the year before. A third of those recruitments were to the Northeast. We expect that to expand as we build programs. We are committed to an open staff here at CMC. And what people often don't realize is we have open staff that is non-Geisinger, non-employed, servicing GWB and GMC. And we suspect that for the indefinite future, the vast majority of the work that's done here at CMC will be done by non-Geisinger, non-employed physicians. So we are committed to working with them and building together. The other thing is that a number of us have talked in background to you all about one of the effects of healthcare reform and one of the effects of all the uncertainties about healthcare reform, and that is consolidation. And you're seeing that right here in this part of Pennsylvania. And I think the way it's working out, I think we can prove to you over a period of time that it's going to be a good thing for the community. I think two viable systems up here that represent fundamentally different business models will be a perfect choice for the community and a perfect choice for the businesses that still pay a huge amount for healthcare delivery. So we're really excited about this, and I think I'll just stop, and Bob and I will be happy to take any questions.
Bob, question to follow what Dr. Still said on consolidation. The reality is, with consolidation happening all over the country, did you feel that at some point in time CMC had to consolidate somewhere, sometime with somebody in the next 2 years?
You know, I'll be honest, is we went through a very conscientious and deliberate planning process. And the focus was most on where we felt healthcare was going in America and how do we best position. You know, certainly when you look at a community and you see 3 hospitals with 750 hospital beds or 700 beds within 6 blocks, that doesn't make sense. But our focus was care for the patient and the population health, which brought us to sort of a natural decision to work with an integrated healthcare system representing a continuum of care, allowing us the ability to manage a population's health. So the planning process was involved, to say the least. There wasn't one particular move that drew us in any direction, but it was really looking at the future of healthcare and figuring out the best partnership. And we, our board and our leadership, felt very comfortable with an organization that has demonstrated the success Geisinger has and invested in the healthcare in the region. It was a natural fit for us, and integration was very, very important.
And nobody's questioning Geisinger as a partner. My question is could CMC survive or thrive versus just surviving without the partnership and without the consolidation that you're seeing just about everywhere in the country?
Well, you know, as in the planning, it's really not about survival. It's about thriving and giving back to the community. Personally, if we can't advance our mission, I would step out of this position. So I wasn't looking for a survival strategy. Are we running okay? Yes. Have we improved financially? Absolutely. You know, are we stable? You bet. But this was more about how do we go forward and what the future, you know, how to position ourselves to really raise the bar in terms of our charitable mission. And so, yeah, I think what you're seeing actually is significant and playing out. And that was also a backdrop to this, but our focus was on creating a future for successful delivery of healthcare.
And I think our commitment, which is important for you all to know, is to keep the acute care hospital open and growing. A huge amount of what will happen over the next 6 months as we go through the regulatory process is going to be to actually prioritize the programs we want to build. There's probably about 9 programs that have been articulated that are either hospital-based or feeder programs that we will build. The plant is tired, no offense, but there's going to be a significant amount of the $158 million that is to refresh the plant. And we want to compete for the business that is non-Geisinger, non-employed physician business here. And we think we'll be able to do that very, very effectively with program building and plant renewal. And I think, again, I think our national reputation has been built on doing innovations that bring more value to the people we serve. And I think that we have we want to bring that to Scranton. We've been growing our employee base 5% a year in the entire system for the last 11 years. Now, the magic of compound interest. That means we've gone from 7,000 employees to over 14,000 in the last 10 years. We expect a similar increase in the job numbers here. So the 1,400 jobs that are here are guaranteed. They're going to stay. The union contracts and the employment agreements are going to be accepted by us. But we're expecting that over the next few years, with what has been agreed to, we probably are going to have about a 5% increase in jobs just naturally, as we have had in the system, by expanding the services that we provide.
Obviously, we've been in discussions before, CMC and Geisinger talked about this. What makes it different now? Why do we get further now?
If you study these kinds of transactions, you'll see that many of them have stops and starts. And in that process, 2 parties get to know each other better. And so I look at the history here in the dialogue as foundational to where we are today, actually. What we did was we applied a discipline to the planning process that helped bring it to fruition this time. But I see that as all productive foundation.
Yeah, I think when we had our previous discussions, we were on the same strategic level, but having a permanent CEO here in Bob was a huge difference, And again, having a negotiation that then leads to a transaction that Bob is going to be responsible for largely is a very positive thing in our view. And then again, we'd gotten a really good set of interactions with the docs up here, the non-Geisinger docs, in probably 6 or 7 areas during the first discussion, and we just built on that during the second discussion. So again, this is a big deal. This is a big deal. And the values and the culture, generally, as you know, is what makes things work or makes things fall apart. And we all felt we weren't ready the first time, but we felt the second time we were ready. And I think it's a natural process. Jeff, you should comment on that. You were an important advocate for both discussions. I mean, would you modify what I said?
No, I agree with what you're saying there, definitely, and I think that Bob has made a tremendous difference relative to being able to bring the parties together. But definitely, we respect Geisinger, the number one focus was quality. We are looking to advance quality in this area.
And value. I mean, this is a healthy hospital with a healthy tradition, with healthy docs, and I'm really looking forward to this. And we have healthy competition now, and I look forward to that as well.
You guys wonder how much CHS's takeover of Mercy factored into this?
How much is what?
The community health system's takeover of the other Scranton hospital?
How much it?
How much that That factored into,
It was irrelevant. I mean, I predicted that's what was going to happen. And we're predicting that other consolidation is going to happen as well because of all the insecurity and the anxiety about what's going to happen with healthcare reform. But that was really irrelevant to our discussions.
Are you concerned, however, that CHS is going to buy a second hospital, so they're going to have a bigger presence in Scranton?
We love it.
Can you elaborate?
Well, you know, we think that this is a two-hospital market. And we think with strong capitalization, which CHS obviously has as a for-profit, with our relative well-being at Geisinger as a not-for-profit and ability to get capital, that we will both be able to build programs that benefit the community. And we have a substantially different business model than CHS. CHS is a great competitor. They'll give us a run for our money in terms of hospital efficiency. But we are committed to a continuum of care that's not just hospital-centric, period. End of the story. The other thing is, we're committed and obligated as a fiduciary for a not-for-profit to be here forever. They're not. So again, I really believe they're going to be strong competition for us. There's nothing like strong competition to get people motivated. We think there's going to be choice for the community, both in terms of patient care as well as the businesses. And we look forward to winning.
You talk about competition, but in the consolidation, Dr. Steele, isn't essentially competition being reduced by the number of entities that now own hospitals?
You know, you're absolutely right, but the question is, you got to have competition, you got to have choice. If you have too much, everybody suffers. If there's too many hospital beds, if there's too much care being given because people are trying to stay alive, if the incentives are all based on payment for units of work as opposed to, you know, people doing better over a period of time, you know, you can have everybody hurting. If you have too little competition, then you got some real issues in terms of economics 101 and taking advantage of that. You got to have the right amount. We believe that what we've experienced, I hate to bring this up here, but what we've experienced in Luzerne, which is going from 3 failing hospitals to 2 really healthy systems with different models, different business models, is a good thing. It's a good thing. And I suspect that 2 different systems here, both well capitalized with different business models, would be a good thing for the community. Now, we plan to bring value to this community, and that is medical service when it's necessary in a very efficient manner. And as I say, we are committed not just to very, very good hospital-based care, but the entire continuum of care, including taking better care of chronic disease so people don't need to bounce in and out of the hospital for tune-ups. So again, you know, I think it's got to be the right amount of competition.
We were talking earlier about previous deals involving CMC and Geisinger. Why did the last one collapse exactly?
Well, you know, I think we basically we're just not ready to consummate. I mean, you know, it's actually this negotiation has been quicker than the negotiation I had with my wife. So I think we just weren't ready. Bob, do you want to?
You know, again, I think if you really look at these transactions and how they play out nationally, they take time. And that involves, sometimes they have to die once or twice or 3 times. I think some of the most powerful configurations in America have gone through that pattern as people have come together. And so I see it as very natural. It deepened our conversation the first time and the second time. And I think we got to the serious matters very quickly here the second time around and understood each other and were able to carry off a successful negotiation to achieve this result.
Can you tell us a little bit about what happened today? I know that you did tour the facility, Geisinger did. Can you just talk a little bit about what happened?
Well, you know, I've toured it a number of times, and every time I've toured it, the first thing that I've been impressed with is is how clean it is. And that's usually a really good sign that it's well managed and that people care about what they're doing, which is providing wonderful care for folks. What I noticed this time was an enthusiasm. I think with all of the concern and the discussion and the multiple speculations about the consolidation that we're talking about here, I think actually coming to a conclusion probably has created a sense of let's move on with the employee base. I think you've got a great employee base. I think my standing up is basically saying your jobs are secure and we're going to build a program is a good thing. I think people are responding to that. And quite frankly, I think Bob and your trustee leadership has done a good job preparing people for this. So, again, I'm biased, obviously, but I felt as if it was very, very positive walking around. Now, there are challenges. I mean, all you have to do is go into some of these busy units and you understand that a lot of the commitment that we have for capital infusion is necessary. But again, you've got a great group of people working very hard. I think they're enthusiastic and comfortable getting off the dime and moving ahead. So I sensed the real positive. But Jeff, what was your sense, Virginia?
Definitely very receptive. Everybody was very receptive of the message that we were talking about there, because we're talking about building programs, building services, expanding what we're doing there, and creating jobs.
I think
If I could say something, Glenn, I think that everyone in this area is thrilled to have Geisinger here. Everyone kind of feels it was long in coming, and now it's happened. But at the end of the day, our job as board members is to make sure that the patient wins, and in this today, the patient wins.
We began the day talking to our employees. We went from there to speak to our medical staff in a big combined meeting, and then we toured the facilities. And I think we accomplished a lot in a very short period of time. Today is really the first step on a bridge to the future for CMC. We began our journey 114 years ago based on a mission that was developed by 15 visionary women. Today, we take the first step on a bridge to the future with an organization that has a world-class reputation, not as a hospital, but as a health system, and has demonstrated very significant success in improving the health and well-being of the population they serve. We couldn't be more excited today about this relationship.
If you were to come back here 5 years from now, what changes would you notice, and what would it feel like?
Well, we probably have about 4 or 5 programs up here that are bigger or that are here or will be here then that weren't here now.
Such as?
Such as a really top-flight neurosciences program, okay? Such as a community practice group that includes Prime Ed but is much bigger than Prime Ed. Such as some behavioral health commitment to the community, which really needs it. Such as pediatric urgent care, such as transplant, I'm talking about organ transplant, such as a very viable level 2, both here and at GWV, but somehow figuring out how to build that together regionally, not closing one down or maybe even making it a level 1 where we're training emergency physicians of the future. Such as very viable residency programs in the major specialties, not just internal medicine, but in the other major specialties. So those would be the examples. And a viable electronic health record that would connect us throughout the entire system. I mean, you've got an EHR in the emergency room, you've got an EHR, but we're talking about throughout the system. And a vitality in terms of recruiting people here, regardless of whether they join the Geisinger clinic as employed physicians or whether they join the individual private practices. A vitality which really brings, for every doc you get 4 additional jobs that need to be in the back office, that really brings something to the community that goes beyond the healthcare mission. The healthcare mission is primary, but what we're seeing is a vitality that comes to the community that goes beyond that.
What's the likelihood that this will be approved by the AG in the courts?
Well, we think that it's very high. Frank, you want to comment on that? Frank Prendelak's our COO.
There's several regulatory agencies that we have to file with to seek approval. The Department of Health should be fairly straightforward, and we expect to get that approval fairly quickly. The Attorney General has two sections we have to deal with. The charitable trust section, which again, the nature of this transaction, that should be straightforward. Then the antitrust, with the CHS kind of plowing the way in the market. We expect we're going to get asked a lot of questions, but we feel we're going to get approval. The issue is timeline, and as Bob indicated, hopefully within 6 months we'll get that approval. We also have to file with the federal government a Hart-Scott-Rodino filing, which the FTC and the Justice Department will weigh in. Whether they formally do an analysis or they take that, their comments and give it to the Attorney General, we'll have to wait and see. So we're optimistic. We think we have a good story to tell. We think there's still plenty of competition in the market, as Dr. Steele has indicated. And so we'll begin those filings in the next week or so.
When did this latest round of negotiations actually start?
Yeah, let's see.
It's been a while.
Yeah, I'd say we really rolled up our sleeves in December.
I'm trying to parse the various discussions, Mike, and I can't, so I'll go with Bob's answer.
Well, if there aren't any other questions, I want to thank you for your time.
Yeah, thanks very much for showing up.
Appreciate it.
Yep.
Questions as far as the competition in Scranton. A lot of people wouldn't want to be competitive with the for-profit company. Why do you see that as such a big challenge?
Well, again, we're committed to this community. Once we've gone through this very extensive, very careful negotiation, we're committed to this community forever, period. That's part of our fiduciary obligation. And we're committed to a different proposition. Our proposition is the care right across the continuum, whether it's primary care, whether it's specialty care, whether it's hospital-based, whether it's non-hospital-based. And so if you have, and we've done well, quite frankly, we've done well over the last 10 to 11 years. So if you've done well, and you've got a good balance sheet, and you've got good access to capital, and you've got a distinctly different business approach, business model, I mean, I'll go up against anybody. And I think it's good for the community to have those two different models. CHS is terrific. They're good people. They've got good values. They're hospital-centric. And I think it's good because we can get our folks torqued up. We can't just lay back. We really got to work our tails off in order to compete with them. I think that's great.
Why did you like Scranton as a viable market to enter even a couple of years ago?
Well, you know, I think, as I've said a number of times, you know, I see Interstate 84, and I see Interstate 81, I see Interstate 80 as bringing a huge number of folks out of the greater metropolitan New York area up to Monroe, Pike, Wayne. A lot of those folks are either going to come to Scranton for their specialty care or for their doctor, their primary care doctor, because it's convenient, as long as they know that they've got a credible system. And it takes two things. It takes good docs, which you guys have, and it takes a credible brand, a credible system, which you guys have. We're bigger. And so getting that brand up to Northeast PA in two different markets, both Wilkes-Barre as well as Scranton, is the next step for us.
What is the relationship going to be between the Wilkes-Barre and Geisinger hospitals and the CMC out there at town?
Initially, almost zero. Initially, we're going to be looking at this as a particular market, a particular expansion. We're going to be doing program planning and coordinating that with our capital commitments that have been negotiated, the $158.6 million or whatever. So initially, it's going to be run as a separate compartment. There will be areas of overlap. For instance, as I mentioned earlier, there's a level 2 trauma at GWB, there's a level 2 trauma here. Both are terrific. Maybe there's some way that working together, we can actually turn it into level 1, which means you're training the docs of the future. That would be the next step. And the branding, the branding will be, it'll be Geisinger Northeast, but we will have Geisinger CMC as a separate standalone commitment for the near term.
What was it about CMC? A couple of years ago, Mercy, Moses Taylor, CMC were all independent. Why did you focus on CMC, or why did they focus?
Because we thought it was the leader in the market.
And you still obviously thought that today.
Absolutely. Absolutely. Our first choice is always to deal with the leader in the market.
And why did you think that?
We looked at the numbers. We looked at the history. We looked at the tradition.
You talked earlier about things that you would like to see added in the next 5 years. Is there anything that will be removed? Any programs, any specialties that you think we don't have that need here right now?
First of all, I can't comment on that because I don't know the details well enough. And we've really been talking about adding jobs, adding programs, adding value. If there are things that we discover during the next 6-month process, I would feel much more confident about detailing it at that time. But right now, there's nothing that jumps to me. It's not that I know something I'm not telling you.
Thank you very much.
Great.